Hi friends, welcome to my channel. Coming to the hypotonic fluids. Hypo means less. That means the concentration or the solutes present in the hypotonic fluid is less than that of plasma. As the concentration is less, the water content should be more. So the water content is more than that of plasma. As water content is more, they are nothing but the diluted fluids. So the water moves out of the plasma to other places where there is comparatively less amount of water, that is into the interstitial fluid and intracellular fluid. And so as the fluid enters the cell, the volume of the cell increases and the size of the cell increases. It causes swelling of the cell. Examples for the hypotonic fluids are half normal saline, also known as 0.45% normal saline, 1/3 normal saline, 1/4 normal saline, 1/5 normal saline, and 5% dextrose. As we already discussed, this 5% dextrose is isotonic in the bottle. Once it reaches the blood plasma, all the glucose or sugar present in the 5% dextrose is utilized by the cells and it becomes hypotonic. So we have taken 5% dextrose as an example of hypotonic fluid infusion. Once the fluid is infused into the blood vessel, as hypotonic fluid means it contains more amount of water than that of plasma. So it moves from a place where there is more amount of water to a place where there is less amount of water. That means it moves from the plasma into interstitial fluid and then into the cell. As a result, the volume of the cell is increased and size of the cell is increased. Swelling of the cell occurs. So why do we want the volume of the cell to be increased, or why do we want the cell to be swollen? In conditions like cellular dehydration, the cells are already shrunken. So infusion of these fluids restores the volume of cells. Cellular dehydration is seen in hypernatremia, hyperglycemic hyperosmolar non-ketotic coma, diabetic ketoacidosis, diuretic overdosage, hypertonic dehydration, that is dehydration caused due to the overusage of hypertonic IV fluids. And also they are used in gastric loss and conditions which require slow rehydration. Coming to the precautions that should be taken while infusing these hypotonic fluids. These fluids should be infused slowly because rapid infusion causes cerebral edema and raised intracranial pressure, because the fluid moves from the plasma into the cell and causes swelling of the cell. As a result, cerebral edema and raised ICP occurs. Hypovolemia should be looked during infusion because the fluid moves away from the plasma. So the plasma volume is decreased and so hypovolemia can occur. So hypovolemia should be checked during hypotonic fluids infusion. If it is present, the fluids should be stopped. Hypotonic fluids should be avoided in liver disease, trauma and burns. As we know, in trauma and burns, hypovolemia occurs. So we require rapid rehydration, but it is not possible with hypotonic fluids. So they are not useful in these conditions. They are also not useful in other conditions which require rapid rehydration.